Good morning. I'll be taking you through the KenyaEMR functionalities, and to start with, allow me to log in. And once I log in, at the facility level, once the user logs in using the login credentials and select the location where they are, then they are redirected to the active visits, whereby they can be able to see the patient with active visits. Then to start with, the first functionality that I want to showcase is on how we are issuing the NUPI on KenyaEMR 3.x. So on the top right, we have the add patient icon, and when you click on that, it will be able to pop up with registration form. And to start with, we have the client verification with the client registry. So this is whereby it automatically select the country, but you can be able to change if the client is coming from any other country other than Kenya. So for the document that are used, we use the national ID number for the above 18 years, the passport number, if the ID number is not available for those who have the passport number, and then we have the birth certificate number for the below 18 years of old. So I'll pick national ID number and then show you how we verify. And starting with the first case scenario, whereby you validate and be able to get that the client information exists within the registry. These are the details that you'll be able to get. And once you see this, you'll be able to know that these details exist within the client registry. So what you need to do, just use the values to avoid duplication of the client or the patient within the system. The next scenario is whereby you find a client does not exist. So when you validate, uh, using a number whereby a client does not exist, this is what you'll be able to see. And then the system asks you whether you want to continue to create and post the client. And when I click on continue, then it allows me to record the name of my client, then even the gender, and then the date of birth. There is a date picker, and if you don't know the exact, you can be able to use the estimated age. Then you'll be able to see all these other identifiers that you can be able to include. The national ID number has been auto-populated from the earlier that we provided. And then even you can be able to notice we have the social health insurance number that the system accepts you to key in. And then even continue the contact details, and this where the client comes from, and it helps when it comes to tracing of our client. Then the next thing is the telephone number, and all these helping in tracing of our client. We have the residential address, including even the landmark and the nearest health center, which is mandatory for you to be able to fill, so that it can help when it comes to tracing of these clients. Once you fill all this information, then you need now to fill even the demographics. Then once you fill the demographics, you just fill on the relationship if it's you have an available relationship for a client, and then the next of kin details. Once that is done, you post to registry, and then you'll be able to get that an alert that has been posted. And getting back to your identifiers, you notice that the NUPI number has been issued. Then you register. Then upon registering, the system will give you that an alert. It was successful. Then it will be able to be redirected to the home page of your client. And then I want us to check in and start offering services. But before we get to the next issue, there are some of the facilities whereby they try verifying, and due to some possible error, some possible challenges, maybe internet, they'll be able to register but not verify. But later when they get internet, they get to the NUPI verification dashboard, and then where we have the patient list, they can be able to see those clients are waiting or having pending verification, and then they can click on the action where we have the verify client and continue. Then we have other communication that comes from the client registry back to KenyaEMR, with the verification errors, meaning that these clients were verified, but there was an error. So within this list, you'll be able to see a column of IPRS errors, which indicates where the error was. So the client was verified, yes, but you can be able to see that the client names do not match. So whatever the ID number with the names could not match with whatever was within the client registry once it is submitted to the IPRS. So it's now called for an action within the facility for them to be able to give the correct information. Getting to the next issue, how the next functionality, how machine learning has been used to aid in screening for HTS eligibility screening. I need to check in, and upon this checking in, need to select the visit type, and how KenyaEMR has been enhanced also again to support facility-wide. You can be able to say we have billing within checking in so that you can be able to take care of those patients coming in to seek for those payable services other than HIV. But for the case whereby we have the HIV, we have a question, is patient exempted from payment? And when you say yes, then you don't need to fill the payment methods or even the billing for the service, but get to the queue location and specify where the client is moving on to. So you can say that it's the CCC, and we can specify the service that the client will be starting with. So if it's tried, then we can be able to check in. So when you check in, you can be able to see the visit was started successfully, and then we can start by recording doing the HTS eligibility screening, just only to showcase this is the form that it's used for screening, and the user, the facility, just responds to some of these questions, and the mandatory ones have an asterisk, and then that is the population type. Can be able to specify the department, the patient type, the client, whether the client is a healthcare worker, getting to the strategy, and then the risk assessment, so that you can be able to, the machine learning can be able to predict whether the client, be able to give the risk score for our client. Then once you're done, then with the TB risk assessment, then we have the get HIV risk score. When you click on the get HIV risk category, the system populates for you and be able to tell you what is the generated HIV risk category. Depending with the risk that you get, then you can be able to respond to question the last two questions, and it is left at the discretion of the healthcare provider to be able to respond to these. We primarily do not say that it's a must to follow whatever machine learning has given you, but it is something that guides you on responding to the two first questions. That did you recommend for HIV testing? And if you say yes, you need to specify why you recommended. Was it because the client was eligible just only by responding to only the questions, or it is because based on the HIV risk category from the EMR that machine learning gave you, or it's because both of client being eligible or the risk category that was generated from the EMR. So then from there, depending on that, let's say that you get a risk category by it says it's either high or highest probability of turning HIV positive. Then the user again navigates back to the clinical forms and picks the HTS initial form, fills this form with the test history, and this is the patient testing, previous testing history, the setting, the approach, the TB screening, and then gets to the HIV testing. And when response to the question has consent been given, and you say yes, then the system allows user to be able to record the testing outcomes. So for example, if we say use to determine, and that was the lot number, and then the expiry date, and then you give that the HIV test one was negative, you'll be able to notice that it give you the final results, but you'll be able to notice under the client referral for other services, when you say yes, it will give you the preventive services that you can be able to refer. So this is in conjunction with the test result that you received, and even bearing in mind the ML risk score that we generated can help you in making that decision. If Again, let's say the HIV test 1 was positive, and then you did the confirmatory, the first response, and then got the results being again positive. Then it will give you the final result being positive. And when you get to uh, this part, you'll be able to notice that now the even inclusion of the recency screening. And again, the preventive services will no longer appear because now the client is positive, but you need to refer for care and treatment. So that's how machine learning can be able to aid us in knowing the ones are probable of turning HIV positive, and for those who are negative, how we can be able to link them for preventive services. Getting to the other part whereby clients coming for any clinical uh, management. So when you navigate to where the form by the name clinical encounter, the healthcare provider can be able to record the patient history and even and having, for example, if we say yes, and let's say you say add, and we want to add cough, then we specify the duration being 8 days. Then the onset status, so you can be able to record all these presenting complaints as many as possible by adding, and you can be able to record all this history as given by the client, even whether there is any adverse drug reaction, and if it's yes, you'll be able to notice a follow-up question for the family status, which is validated as per the gender, maybe condom for our client who is a male client, then do you smoke cigarettes, either yes or no, and we have a lot of this family history or history that can be given by our client. Then next, you can be able to do even the patient examination, responding to general examination, which is a multi-select. If you're having any general examination, but if it's none, it grays out the rest. Then you can be able to do the system examination. Was it normal, or there a problem with any system? So if it was abnormal, again you need to speak to which part had an issue and what was the findings. Then give the clinical diagnosis, and this is by entering to a more characters. Then from the same part, you can be able to do an investigation, and when you say yes, then you can be able to order a lab order from this section. So when you click on the add lab order, then you can even be able to click, let me for example we do the complete blood count, can be able to give a lab reference number and then the priority and then save order. So once you save, you can even be able to add more than one from this part. And again, if there is any radiology that you want to order, you can be able to make it to order from here, just the same as we've done with the lab order. And any procedure that you want to do, you can be able to do it from this section. And then sign and close. Then from there, you can get to the patient management, whereby you can add the final diagnosis by again searching using the first like two characters. Then if there was you want to make a drug order, so once you select on the drug that you want to prescribe, then you can be able to confirm the dosage. Then you can key in the dosage of the drug that you want to uh, prescribe in terms of whether it's a tablet or the milligram. Then the route, we have a drop down there, the frequency of the drug that you're giving, if there is any additional instructions that you like to be added. Then we have the prescription duration with prescription date, then the duration that you're giving the drug, maybe let's say 5 days for this use case, and then the dispensing instructions, how many tablets do you want to be dispensed, the quantity, And then if the prescription refills, they can be able to indicate, and then maybe the indication that can be uh, you can just give an indication and then save that order. So once you save the order, you can be able to see that drug, and you can be able to add as many as possible. Uh, then you sign and post. Once you're done with that, you can proceed with any therapies that have been prescribed. If there is any, maybe the support groups, you can be able to select any counseling that has been prescribed. Maybe let's say psychosocial therapy, and any procedures. If there is no any, and the patient outcome, let's say being released to go home, then you can be able to add appointment from this, and takes you to the appointment. Choose the location, that is the name of the facility you're giving. So we notice that we have uh, populating all types of appointment that you can be able to give. It's a consultation, you can be able to include. If it's any other, then you can be able to include from there, and the appointment type, then the dates. Then you'll be able to see a calendar for you to be able to manage your appointments. Uh, this calendar is supposed to give you the number of clients that have been scheduled for any clinic within those days, for you to evenly distribute your clinics. Then you can be able to even uh, select the status. Then you can be able to save and close. Or those, sorry for that. Then once that is done, you now can save your form, and it will have saved successfully. The other bit that I just wanted to show you, it's how we're managing the trage recording of the vitals, so that you can even be able to manage some of these NCDs. And when you key in, for example, a temperature, that can be the 38 or 39, you'll be able to see an alert appearing that the temperature is out of the normal range. And that has been done for all the vitals, so that the clinician can be able to do clinical management, can be able to do to be able to make their decisions in terms of the clinical management that they want to offer to the uh, patient. So just went to key in the weight and height, then you'll be able to get the BMI, and then even the nutritional status. Yeah, so that's all on it comes to the management of the client using that system. You can be able to view other information that has been recorded, or the existing or the historical information.
Assuming there are so many service points and also that the patient has already been moved to the pharmacy service point, the pharmacist will be able to now pick it up from where the doctor or the clinician has left from. And this is by just now logging into their specific location using the pharmacy location, of course. And then, of course, now they can be able to go into providing now the specific services for this particular patient. By going to the dispensing app, the pharmacist will be able to view all the clients, all the patients. They should also be able to expect that they're coming in to be able to also get some drugs. And again, also the feature or the application here will be able to provide the pharmacist a way to be able to filter by patient ID or a patient name, depending on what they're able to be given as part of identification by the patient. So I'll come and just search for our patient Ujwang, which we can be able to see them here. And I can be able to see that they currently have an allergy in terms of caffeine. This is before I can be able to dispense. And from here now, I can either now be able to continue by doing this dispensing of this particular medicine that has been prescribed, or I can pause it and provide the reasons why I've paused it, or I can just close this, which again basically will now go back to the clinician as an incomplete drug prescription. So for this purpose, I'll just do the dispensing bit, which I'll just click on dispense. As you can see, it is trying to load from the stock management module just to ensure that we are dispensing what we currently have available within the facility and nothing more or nothing less than that. So I'll just click on dispense the prescription. Rest of the fields have already been filled up by the clinician or the person who ordered for this drug. So I'll just click on dispense this prescription. Upon clicking that, it will successfully dispense, and I can be able to see the message of successfully dispensed, and I can go to the all prescriptions, where now I should be able to see my specific patient that I've dispensed, and I'll be able to see the status as completed from what you can be able to view here on my screen. And that is the process in terms of dispensing drugs to a patient. Again, I can go back to just the service queues and see if there are any other patient who has been added in terms of the pharmacy by just clicking on the pharmacy bit here, and it will be able to, of course, now filter for me, only for me to be able to see for pharmacy bit. So that's the process in terms of dispensing drugs to a patient at this facility level. So I want to jump right into now the stock management module, which now should be able to now give us a bit of high level view of how we are able to add stock, both pharmaceutical and non-pharmaceutical. So I'll log out and use some different credentials to be able to, of course, interact with the stock management module. Given that it is a stock, it's a role-based access module. So I'll log in as a main store user. And again, of course, I'll choose the location as main store, continue on the same. Then I'll go to the applications module here, where now I'll click and now go directly into the manage stock. Clicking on the manage stock, I should be able to see some few details in terms of my dashboard, which would give me information about the expiring stock, out of stock, disposed stock. I'll be able to see all that information, and also some inventory alerts in terms of what is almost expiring, receiving what is almost what I've already received within the facility, and issuing what I've managed to issue from where to where. Basically, I should be able to see that information. Then I can get into now the nitty gritties in terms of the day-to-day operations. I can be able to do this within the stock management. So clicking on stock items, it will be able to give me a catalog of all the stock items that I have within the facility. Again, I can be able to add this. As I mentioned earlier, I can do both pharmaceutical and non-pharmaceutical items in terms of adding a new catalog. So I just come here, put all that information, put the packaging units, transactions, the batch information, what is the quantities, and then what is the stock rule. Stock rule again will always help me in terms of ensuring that I can be able to get notifications before the stock actually expires. So that really helps in terms of ensuring that stock doesn't get doesn't go bad without the person who's managing the stock noticing that. So that is in terms of adding stock. Again, also I can be able to, of course, import this using an Excel just to make my work easier. I don't have to really put one by one. I can just be able to use this the Excel file to be able to, of course, import all this stock. Then moving on forward, I can also do operations here. I can be able to start a new operation. I can do a negative or positive adjustment. I can also be able to do disposal of any stock. I can also be able to do opening stock, and this applies across the various stores that we have within a facility. I can also do a receipt from outside sources. I can also do a requisition, meaning that it is inter stores. I can be able to do that requisition. So from requisition can come from the pharmacy all the way to the main store. Then I can also do a return. That means from one store to another store, mainly to the pharmacy, to the main store within the facility. I can also be able to do stock issue, and this only applies from the main store to all other stores. Then I can also do a stock take and also transfer out, which applies outside the facility. So these are the various operations I can actually be able to do within my facility, given my role as a main store manager. Moving on, we can also be able to give specific stock user role and add some scopes for them. I can come select a user. I can be able to say what their role will be. I can also be able to set the limit in terms of the time that they should be able to access some specific operations. So either I can say this is an enable between this date to this date, or I can say this is a permanent one, which now basically will make sure that it doesn't expire in terms of the role that I have managed to provide or give to this specific user. Then I can be able to say whether they are going to only be doing transfer out or receipt or a stock issue. Then I can also say where exactly are these operations confined in. So are they only applying within a pharmacy, which I can be able to say that, or are they applying probably in another store within the same facility? I can do that and be able to, of course, save and move on. Then we have stock sources, where I can also be able to now add a new source in terms of someone who can be able to supply for us drugs. So either it's from a donation, either it's from a commercial retailer or a wholesaler. I can actually be able to do that and add as many as possible. So we already have some already existing, and I can also be able to add more. Then, of course, we also have stock locations. This provides me a way of adding locations within the same facility. Maybe we have a location in the radiology department. Maybe we have a location for storage of stock, maybe in another department for special clinics. And the rest in a kidney urinalysis department. We can actually be able to add as many stores as possible for the locations in terms of operations of these stocks. Then we also have reports where I can be able to, of course, generate reports, and this is a way just to be able to provide me a way of course, sharing reports to my supervisors or someone who basically I report to, just in terms of how our stock status looks like. I can be able to do that, run that report, get that information, and of course share with them for purposes of just having an overview, or of course for the purposes of also accountability at the end of the day. So that is in terms of the stock management module. The stock settings just provides me a way of setting up the whole stock management module from the scratch all the way to now, showing what I need to be able to see. Of course, here I won't get into that, but in an overview nutshell of what we basically have as a module within KenyaEMR, it provides you a quite extensive way of managing your stocks, whether in a level to level 1 facility all the way to a level 5 facility. The application is well extensive enough to, of course, manage your request and, of course, your features that you might need. And that is it for me in terms of the stock management. I would like to, of course, now move into now the billing bit, which now, of course, works together in terms of all the services that the patient is receiving. And for this one, it will still require for me to be able to log out and log in as a billing clerk. So I'll log in as a billing clerk within the NERI PGH, now be able to, of course, now interact with the billing module. I'll come here and click on billing, which now will be able to give me a list of all the patients that are currently either have received services already, and they are yet to be billed on the specific services they have received. So billing basically will be able to pull prices from what we have, what we call a billable service management, and also to be able to pull information in terms of all the lab tests that have also been ordered, and all the pharmacy prescriptions that are also being ordered. So it will be able to pull that information in terms of the pricing, and of course now we can be able to bill a patient. So you click on a specific patient, see if they have a bill. So like this patient, we already know they have a bill in terms of 500 bob for a specific item that they were given in terms of clinical consultation as a service. I can click on initiate payment, which will give me the possibility to be able to initiate an M-Pesa SDK push, and put the specific amount that they want to pay through this. So maybe they want to just offset about 200 bob. I can be able to do that through M-Pesa and initiate that. then of course, if now that has already been done, I can come here and add, of course, other more payments, where now I can be able to say that they've done the first bit in terms of mobile payment money, and the amount was about 200. Once you have confirmed the reference number, so you can say SDJ 1000 TY, and that is basically the M-Pesa reference number. Then you can also add some other payment method just to offset the whole balance. So you can see the rest was paid via cash, and the cash was about 300 bob. And this doesn't really need a reference number. I can just click on process payment, and from there I'm able to see that this patient has already been able to offset their bill, and I can print a receipt for them, or I can be able to, of course, print a bill for them. And that is the whole process in terms of billing. And from there, of course, now they can go into claims and go into other management in terms of just billing. And of course, reports also are generated from this. So that is the billing process for KenyaEMR. And I'll end at that in terms of my presentation. Thank you for being a keen listener. Have a good one.